Hello, I'm Dr. Sharif. Today I would like to talk to you about chronic fatigue versus acute onset fatigue. What I'm referring to is the kind of fatigue where you just basically don't feel right throughout the day. You could wake up tired in the morning, uh, and or just feel exhausted halfway through the day, or sometime maybe in early evening when you get home from work. Regardless of when it comes in, when it kicks in, and you could just have fatigue all day long. But regardless of the time, if you have severe fatigue sometime throughout the day, that can obviously impact the quality of your life, and should be addressed. I have a naturopathic general primary care practice, and I would say fatigue, chronic fatigue, is the single most common condition I get to treat on a day-to-day basis. So first things first, a regular conventional blood test is absolutely highly recommended. I mean, there are numerous medical conditions that can be caught just by a basic annual blood test. So you owe it to yourself to make sure you have that done. And what are the top two most common medical conditions that cause fatigue? The first one is hypothyroidism, I would say, and the second one is iron deficiency anemia. Both of which are common, especially unfortunately among women. I don't see nearly as many cases of either condition among males, but I do see them quite often among women. And of course, with iron deficiency, it particularly can impact menstruating women due to the blood loss during their period. And as far as hypothyroidism, you may have the kind of hypothyroidism that's not caught, that can't be diagnosed properly with a regular blood test. You may have what we call subclinical hypothyroidism. I wrote a blog on this subject a while back, so that's on my website. Either condition, hypothyroidism and or anemia, can be easily addressed using the appropriate therapies. So in the majority of cases, if you have hypothyroidism, the solution would be hormone replacement therapy. Whether it's synthetic like Synthroid or levothyroxine, or natural like Armour, Naturethroid, etc. Of course, you can also treat hypothyroidism, especially if it's borderline, using different nutrients like selenium, zinc, etc. But as a general rule, it's rather easy to treat hypothyroidism. Same thing with anemia. If you have iron deficiency anemia, the solution clearly is in iron supplementation. I must say that for ladies that have heavy female periods and anemia, whether the anemia is caused by the heavy periods or some other cause, it can be challenging to treat the anemia in a lady with heavy periods. So we need to be vigilant as far as what all needs to be done for such a patient. Sometimes the fibroid needs to be removed if it's severe enough. And of course, just giving such a patient iron is clearly not enough. We need to address the heavy bleeding. So those are just the most common medical conditions that I see in my practice that cause fatigue. And of course, there are other medical conditions like diabetes, which is notorious for causing fatigue. Sleeping disorders clearly can cause fatigue. Depression and fatigue to me go hand in hand 99% of the time. And needless to say, more serious medical conditions like autoimmune disorders, cancers of all types can definitely cause fatigue as well. So proper diagnosis is absolutely key. Without proper diagnosis, really, of any condition, how can a practitioner address the condition? So you don't want to do guesswork. You want to make sure you get properly diagnosed. And of course, as you might guess, sometimes it's more difficult than one can imagine to come up with the exact reasons why a person is feeling fatigue. It's usually not one reason. There are usually numerous causes that are working together to get the patient's energy down. So what I would like to emphasize today regarding the subject are what I call non-medical conditions for fatigue. These are conditions that really cannot be properly assessed, practically impossible to assess based on conventional methods of diagnosis, including blood tests and or imaging studies, or even physical exam quite often. So what we're talking about are things that I would say alternative medical practitioners such as myself, we have to address in our day-to-day practices. However, unfortunately, conventional medical practitioners, they typically don't address these non-medical conditions or causes that could be contributing to your fatigue. And what are these contributing factors? So at the top of the list, we have proper lifestyle and diet, or should I say, I'm sorry, I meant to say improper lifestyle as well as unhealthy eating. So under lifestyle, there are of course numerous lifestyle reasons why you could be experiencing fatigue. At the top of the list, I would say poor sleep hygiene. Poor sleep hygiene and lack of exercise. Those are the two things that come up all the time. So if you want to feel good, have plenty of energy on a day-to-day basis, you've got to get yourself in bed. I would say ideally before 10, by 10, if not 11 at the latest in the evening. And assuming you sleep well. If you have sleeping difficulties, you happen to have insomnia or sleep apnea, which is a medical condition, then of course that needs to be addressed. But a lot of people, they sleep fine, they just have poor sleep hygiene. They just don't go to bed in a timely fashion. They don't, they stay up till 1 or 2 in the morning and either read or watch TV or whatnot, or they might even have frank insomnia. Either way, that clearly must be addressed. That's like probably one of the top reasons why people feel fatigue is because they don't get good sleep. Either they choose to have poor hygiene, or they just have insomnia and they can't help it. So that must be addressed. And of course, lack of exercise. Lack of exercise, excuse me, lack of exercise is one of, I would say, the most obvious reasons why people feel fatigue, but unfortunately most people don't recognize how that can be impactful on their energy levels. So regular aerobic exercise is probably the single quickest, most effective way of raising your energy. So if you want to feel good, you want to get either walk or jog if you're young enough to be jogging. And if you're not, you feel your knees are not doing so well, or basically your joints are getting older, you can get on a machine like an elliptical machine or treadmill, whatever machine works for you. And some people, they have so much joint pain they really can't even do any sort of exercises like that. And to me, swimming is a great alternative for patients that have they're heavy set and or have enough joint pain that they just can't either walk or get on a treadmill or some kind of machine. So swimming is always a good option. And plain walking that can go a long way as well. So like say 30 to 45 minutes a day of just walking can be highly effective. So lack of exercise and poor sleep hygiene, I would say those are the top two things under poor lifestyle. Now, what are some of the other lifestyle choices or things contributing factors to fatigue? Poor relationships. If you have poor relationships, interpersonal relationships with your loved ones, friends, co-workers, that can definitely impact your energy. At the top of the list, last but not least, is a person's spiritual health. I've come to notice that people that have strong faith and have a spiritual practice, sound spiritual practice, they seem to do better energy-wise. They appear to make better choices in their life. Whether it's in their lifestyle and or dietary patterns, they're more likely, in my experience, going to make better choices. So the list of lifestyle factors goes on, like smoking, for example, not a great thing for your energy, etc., etc. So what about diet? Diet would be, poor diet would be the second most common non-medical cause of fatigue. And when it comes to diet, I like to simplify it by saying, you have liquids and then you have solid food. So to me, your liquid intake is actually more important than the kind of solid food that you might consume. So I just break down the liquids into healthy and unhealthy. So the healthy liquids would be water and herbal teas. Unhealthy liquids would be soda pop, coffee, alcohol, and basically any other junky liquid. So again, coffee, soda pop, alcohol, and soft drinks, would be the top four, and the various combination of junky fluids that people consume these days. And the healthy ones are tea, herbal teas. Even caffeinated teas are fine. Like green tea is perfect. Black tea is okay. I prefer green tea for health purposes. And of course, herbal teas and water. Those are the healthy fluids. Can you have any can you have some unhealthy fluids here and there? Yes, but on a regular basis, I would just not make a habit of drinking anything unhealthy. And you want to be properly hydrated. So proper hydration is a key to good energy. If you want to feel good, you've got to drink sufficient amount of water on a day-to-day basis. And what is sufficient? It varies person to person, and doctors have different opinions about the subject. I think, as a rule, it's safe to say for an adult, say 8 glasses of water a day. I know a lot of doctors say that. Some say, well, it depends on the patient. Of course, it depends on the patient. So if you have kidney failure, you may want to have to limit your water intake. But as a rule, it's safe to say 8 cups of water a day, and ideally it should be filtered. But quite frankly, even if you don't have a filtration system, drinking tap water is better than no water. Its dehydration is extremely damaging to the internal organs, as well as the brain. So, and as far as solid food, there are, God knows, hundreds of diets out there, and I would say, as a rule, one could say every single diet emphasizes the significance of vegetable consumption, adequate amounts of vegetable consumption. So I don't know of a single diet that promotes not eating vegetables. So you can't go wrong with eating a lot of vegetables on a day-to-day basis. So as far as fruits, they're safe for most people. Some people can't do fruits, shouldn't do too much fruit due to the sugar content. As far as the other food groups, like proteins, fats, carbs, really that subject is beyond the scope of this video. But as a rule, if I were to summarize it, whole grains for your carbohydrates, whole grains are wonderful. For your fats, you want to make sure you consume healthy fats. If you're cooking, I would go for olive oil and coconut oil. High heat, use coconut oil. You can pour olive oil on your salad, for example. Deep frying is not a great idea. Try to limit animal fat as much as possible, and try to use more vegetarian sources of fats. As far as proteins are concerned, some people are vegetarian. Most of my patients are not. I believe, regardless of whether you're vegetarian or not, you obviously need to have an adequate intake of protein. It's critical you consume sufficient amount of protein on a day-to-day basis. You don't need to necessarily eat animal products, but of course it's much easier to consume, to take in an adequate amount of protein if you are not a vegetarian. So vegetarians need to be more careful with their diets so they don't become protein deficient. So nutritional deficiencies, in my experience, or poor digestion is probably, in my experience, I would say the single top most common non-medical cause of fatigue. So poor lifestyle, of course, was number one reason I just went over. But poor diet and nutritional deficiencies is probably, is actually even potentially a more common cause of chronic fatigue, and more easily addressed. You can easily change your diet. You may not be able to easily change your lifestyle. Like say, if you're habitually going to bed at midnight instead of 10 o'clock, that may be more difficult to fix. Or if you have any relationship issues, that may be more challenging to tackle versus making sure you're properly hydrated. So diet and digestion is where I like to intervene most of the time, in order to address the chronic fatigue situation for my patients. And I happen to have a nutritional scan in my office. It's a biophotonic scanner. It's a small machine. You put your hand on it, and it measures the amount of carotenoids in your skin. And why carotenoids? Well, this machine, the company that came up with this machine, they figured out that the amount of carotenoids in your skin is a good indicator of the overall amount of nutritional status in your body. You can find carotenoids in a variety of produce, vegetables, and fruit. And so if you have whatever your carotenoid content, the carotenoid content of your skin may be, that's a good indicator of your overall, not only nutritional, the intake of produce, but also is your digestion, absorption, and assimilation. So this test is telling us how well you are basically digesting your food, not just what you're eating, but also how well you're digesting it, how well you're absorbing it into your tissues, and how well this food, these nutrients are making it to your tissues, in particular to your skin. So it's a wonderful way of assessing a person's diet as well as digestion. So going down the list of the most common non-medical causes of fatigue, the third reason that I find people have fatigue is their organs, the internal organs are toxic. They're just filled with toxins, and they really, the organs just can't keep up with the toxic load. So what are these internal organs? At the top of the list we have liver, then kidneys and intestines. So your liver and intestines, of course, that's a part of your digestive system in the front of your trunk, and then your kidneys are in the back. So these internal organs have everything to do with your energy. If they're filled with toxins and they don't do the work they're supposed to do, you can feel toxic and you can feel fatigued. The solution, as a naturopathic physician, what I try to do to address this subject is to offer a detoxification program to my patients. And by detox, in the conventional world, when they say detox, they mean they're referring to when an addict has to, the program, the kind of program that an addict has to go through to get over their addiction. In our medicine, in naturopathic medicine, when we say detox or detoxification, we're referring to cleansing basically the inside of the body, and or one could say we're trying to support the functioning of these internal organs and enhance basically their job, which is to cleanse you. So your liver and kidneys, I tell my patients, these are like filters in the body. You know how in your car you have filters like the air filter and the fuel filter, oil filter. Well, in the body we have filters too, and the top two filters, the main two filters, are your liver and your kidneys. Of course, we have the lymphatic system too, and that's also under this whole umbrella of the detoxification. So a detox can go a long way in improving your energy. And how do you detoxify a person, and what can you expect from a detox program? Well, there are numerous ways of detoxifying people. You can use, of course, diet. Just eating healthy itself is detoxifying. Making sure you're properly hydrated is critical in a detox program. Nutritional supplements can be used. Herbs, homeopathic remedies, cell salts, tissue salts. There are so many ways of detoxifying your internal organs. I would say my favorite, of course, besides proper lifestyle and diet, which are themselves great methods of cleansing and detoxifying the inside of your body. You can actually use various herbs and homeopathic remedies for detoxification. And my favorite way of going about detoxification is using homeopathic remedies as well as herbs. So I go back and forth. Using nutrients to detoxify a patient may be effective if the patient is not too toxic. If you're extremely toxic, and then you take nutritional supplements hoping that they will detoxify you, that might actually make you more toxic. And the analogy would be this potentially inappropriate analogy that I tell my patients, if you have let's say, garbage can sitting in the room and it's starting to smell, and you'd go and pour perfume on top of it in order to reduce the smell, that's clearly not that's not a solution. It's not an effective solution. It's not going to get rid of the smell. So it's in the same way, if the body is extremely toxic, let's say your liver and kidneys are just filled with toxins, and you just pour nutrients on top, that would be like pouring perfume on a garbage can that's starting to smell. It won't work. In fact, it might make you more toxic. You might get sicker. So using nutrients in a very highly toxic person is not really an appropriate way of detoxifying them. You don't want to put more of a load on their body. You want to take things out. So the solution is the problem is being overly toxic, and you need to get some of those toxins out, and adding more nutrients in could help again if you're slightly toxic, but you're extremely toxic to a point where you're fatigued on a day-to-day basis. Adding nutrients on top is really not a wise solution. So as far as herbs and homeopathic remedies, there are numerous herbs and homeopathic products and remedies that can be utilized to detoxify your internal organs. That's beyond the subject of this video, unfortunately, and I'm just going to stop there as far as the detox goes. So what are the other most common non-medical causes of fatigue? I would say adrenal fatigue is probably right up on the list. And we're not talking about adrenal failure, we're talking about adrenal fatigue. Adrenal failure is a serious medical condition, and you can assess that using a conventional medical test, blood test, and or other testing. But adrenal fatigue is not, quote-unquote, a medical condition. Most conventional medical practitioners, medical doctors, and whatnot, they don't even consider adrenal fatigue a diagnosis. So you can say it's a condition, and you can do a test for adrenal fatigue. I recommend a salivary adrenal test for patients that I suspect might have adrenal fatigue, and it shows up on a saliva test, but it doesn't show up on a blood test. If adrenal issues showed up on a blood test, which would be basically low cortisol levels in the blood, we're talking serious adrenal disease. And that's not common but at all. I might have had 1 or 2 patients with adrenal failure in my practice of 15 years, nearly 15 years. But adrenal fatigue, I see patients with adrenal fatigue at least a few times a week. So it's a far more common condition than adrenal failure. And again, for adrenal fatigue, which is a non-medical cause of fatigue, what can be done about that? Well, again, you can use various therapies such as herbs, as well as homeopathic products and nutrients, which are really the top 3 categories of natural medicines. You have nutrients, you have herbs, and you have homeopathic remedies. So you can use these 3 categories of therapies to address just about any issue. So, with detoxification, we just outlined how we could use nutrients, herbs, and homeopathic remedies. Same thing here with adrenal fatigue. We can use nutrients, herbs, and homeopathic remedies to treat adrenal fatigue. There is yet another category of therapies for adrenal fatigue that's called adrenal glandulars. So that's when you actually, there are companies that get the adrenal glands of various animals, say cows, most often, and they make pills from the adrenal glands, and they put them in little capsules or tablets. That's a very potent treatment for adrenal fatigue, because you're literally taking in a lot of the, not just nutrients, but positive hormones coming from the adrenal glands of an animal, and it can be a powerful solution, highly effective solution for adrenal fatigue, but it's not one you want to depend upon, and hopefully you will work with your alternative medical healthcare practitioner to wean off of such products, even if they're highly effective in treating your fatigue. And of course, I would like to insert at this point that you must be properly diagnosed by a qualified licensed healthcare practitioner before you can utilize any of these therapies that I may be suggesting in this video. Proper diagnosis is absolutely key before you ever start treating anything. So the next most common cause of fatigue, non-medical cause of fatigue, would be hormonal imbalances that are not diagnosable using any kind of testing. So you could have, say, estrogen and progesterone imbalance, or even testosterone issues that doesn't show up on a regular test. So again, this would be a non-medical cause of fatigue. So what I do in cases like this is, it really varies from patient to patient. But if I figure out that the person has hormonal imbalances, the solution is basically to play with the amount of hormones they use, whether it's topical or oral, and I usually by far prefer topical use of estrogen, progesterone. And I don't use hormones in every case of fatigue, but in some cases I find that if a patient is fatigued and we can't figure out the cause of their fatigue, I definitely go down this path of figuring out to see if they have hormonal imbalances that have never been properly diagnosed, because it's the kind of imbalance that doesn't show up on a blood test or a urine test or saliva test. How easily can that be fixed? Well, it depends again on the person, but a low dose of bioidentical hormone replacement therapy can go a long way in some cases. And that's an extremely complicated subject beyond the scope of our talk today. But it's worth mentioning that hormonal imbalances that are not caught by a blood test or urine or saliva test could be the cause of your fatigue. The next non-medical cause of fatigue, I would say, is qi imbalance. By qi imbalance, I'm referring to, in Asian medicine, in Asian languages, they use the word qi to refer to energy. So energy imbalances, that can definitely be a cause of fatigue in some patients. So if you're feeling fatigued, it doesn't mean you don't have enough energy. Perhaps you have enough energy. Your body doesn't have a proper flow of energy throughout the system. So improper energy flow throughout your body can cause fatigue. So, like in Chinese medicine, they might use phrases like spleen qi deficiency or liver qi stagnation. They have all these terms to basically refer to inappropriate qi flow throughout the body. And I don't do Asian medicine, Chinese medicine in my practice, but I use homeopathic remedies to address qi imbalances and basically subtle energy imbalances throughout the system. So, and homeopathic medicine is definitely it's not. I would say it's a Western branch of medicine as opposed to Asian medicine, but both systems can be used to correct energy imbalances. And I find homeopathic remedies extremely effective for treatment of fatigue, specifically chronic fatigue. I can think of numerous examples of patients that used to have fatigue for years, decades. As high as much, I would say as high as 40, 50 years of fatigue that ended with the proper remedy within days of using the proper homeopathic remedies. The fatigue, I don't want to say it ended 100%, but it was significantly helped with the correct homeopathic remedies. And of course, you need to see a licensed homeopathic practitioner to find out what remedy you might need, because there is no set remedy in homeopathy for fatigue per se. In homeopathy, we individualize the treatments for the patient. So let's say you have 20 patients with fatigue, each one could end up benefiting from a different remedy. So there could be 20 different remedies for 20 patients with fatigue, potentially. I can't say this particular remedy or these few remedies are used for fatigue. I wish homeopathy was that simple. Going down the list, the next most common non-medical cause of fatigue would be germs, in particular viruses. So if you have, let's say, you catch a flu and you just never completely recover from the fatigue that you got from that bout of flu, that's a germ situation. That's where I could say you're still, a year later, 2 years later, a few years later, you're still being impacted by that viral condition that you caught. So how do we treat that? Of course, again, you can use all kinds of therapies for the treatment of germ-related causes of fatigue. I'm a naturopathic physician, but I'm also a licensed homeopath. So I try to treat just about any condition as often as possible using homeopathic remedies, since I find them highly effective. And so in this case also, in the case of germs, let's say the flu that you had 3 years ago, I try to go at it using homeopathic remedies. And again, we get amazing results. There are it's not common that this happens to people, but it definitely does happen. I see many cases every year of patients that say to me, I caught the flu last year. or 2 years ago, or I went abroad traveling in a acute condition. It wasn't a flu, but it was an acute condition, and I've just never had good energy since then. So when I hear that, my mind goes towards homeopathy, and I start thinking, what homeopathic remedy can I prescribe to this patient to address their fatigue? And I would say is by far is the single most effective method of treating germ-related cases of fatigue. Going down the list, obesity. Obesity, I find, is it's a pretty kind of I would say, obvious cause of fatigue. The heavier set you are, the less energy you're going to have. I mean, that just makes sense. So what can be done about this kind of fatigue? Well, the solution is obvious: weight loss. A weight loss program is in order if that's what's happening. And we have all kinds of weight loss programs in my practice, but we have one that's we call it the 3-week purification program. It's a purification program that results in weight loss. So it's really not designed for weight loss. It's designed for purification / detoxification, but it ends up causing weight loss. I would say on average anywhere between 8 to 20 pounds of weight loss in 3 weeks. The details of that is, again, beyond the scope of this video. So those are the most common causes of non-medical causes of fatigue, as well as medical causes of fatigue that I address in my practice. And again, going back to the medical conditions, what were the top two again? You had hypothyroidism and anemia. And how can you diagnose them? A blood test, in 99% of the cases, is sufficient. In some cases, like say borderline subclinical hypothyroidism, a blood test doesn't show it. Or some people have Hashimoto's and they're being treated for their Hashimoto's or hypothyroidism, but their thyroid is still not quite right. So I'd say some of those cases, of course, you need naturopathic therapies, but nevertheless, a blood test is always indicated if you have fatigue. I didn't mention musculoskeletal imbalances. Those would be, again, a non-medical cause of fatigue. So seeing a chiropractor or anyone that does good body work could be highly effective in treating fatigue as well. I don't do body work, but I refer out for body work quite often in my practice. I believe we covered the top reasons that I encounter in my practice, and hope that this video serves you and or your loved ones. Feel free to share the information with people that you know have fatigue. Just in case you're wondering what kind of results do I get in my practice treating fatigue, quite honestly, I can't think of the last case I saw of a patient that had fatigue that we could not help extremely effectively. So if you can find the reasons, if you can work with someone who's a qualified healthcare practitioner and figure out all the reasons why you have fatigue, and just go down the list and check, address each one, there really isn't a reason why you should be continuing to live your life feeling fatigued every day. There just isn't a good reason for that, unless we're missing the diagnosis, which can happen. And that's why I tell patients, you got to stick with me till we figure out all the possible causes for your fatigue or whatever the condition might be. It's usually not there's usually not one cause behind a problem. It's usually multifaceted. I wish you the best in your journey towards health.